My name is Carlos Martin Kivas. I work for the New York City Department of Health, specifically in the STI program within the Bureau of Hepatitis, HIV, and STI. We're going to start with a little bit of trivia. Today's agenda is to figure out what is a sexually transmitted infection. Some of you may have heard of it as a STD, a sexually transmitted disease. We're going to talk about HIV and aging in New York City, anatomy in aging, HIV specifically. We're going to look at some numbers for HIV specifically for women in New York City in 2023, and some prevention methods for STIs and HIV. And then lastly, the New York City Sexual Health Clinics. We offer low cost or free services to every New Yorker. So let's start with the first trivia question. True or false? All sexually transmitted infections always have symptoms like burning, itching, abnormal discharge, or pain. So this is false. Some STIs don't have symptoms. They're asymptomatic. So you may not have any symptoms whatsoever. For example, gonorrhea and chlamydia usually take a couple of days, sometimes weeks to show symptoms. Same with syphilis. And syphilis symptoms, you may not be able to see. So you may not even know that there are symptoms going on. So that is false. Some STIs do have symptoms. Some STIs are asymptomatic, don't have symptoms, while those same STIs may have symptoms, but it may be delayed, so you may not know it. So testing is always crucial. True or false? Condoms and dental dams can prevent STIs. This is a slight trick question. The answer to this is true. It may be a trick question because if not used properly, then it will not prevent the STIs you're trying to prevent. Some of us may not know how to use condoms. Some of us may not know what dental dam is. So if you're not sure how to use it, if you're not using it the correct way, it may not prevent the STI you're trying to. True or false? You can get an STI from a toilet seat. That is false. This discussion came out from a report that was done on hepatitis back in the early 90s, where they said that the hepatitis virus can live on a toilet seat for 2 or more hours. And people thought, oh my God, I'm going to get an STI from it. This is false because most viruses and bacteria that cause STIs, sexually transmitted infections, cannot survive outside the body for too long. Most of them die off within minutes, some of them within hours. You cannot transmit it. It is best to wear more than one condom to prevent STIs and HIV. This is false because wearing more than one condom can create unnecessary friction and it can damage the condoms. There are internal condoms and external condoms. Do not use them together. Do not use 2 of the same condoms or more. Do not reuse condoms. It sounds like the more you have, the more prevention you have, but not in this case because it's counterproductive. You'll be damaging the condoms and hurting yourself and the other person. True or false? Condoms are not helpful for people over 55 years old because there's little chance of pregnancy. It's false because condoms are not just specifically for pregnancy. They prevent sexually transmitted infections if used properly. STIs are actually more prevalent for older adults because a lot of them think, I can get pregnant or I'm not going to get somebody pregnant. So they do not use condoms. So very important. What is a sexually transmitted infection? And like I mentioned, sometimes these are referred to as STDs or sexually transmitted diseases. That has been the more common words in the 90s and the early 2000s. Before that, it used to be venereal disease. Our sexual health clinics used to be referred to as the venereal disease clinics, which they're not anymore. Now they're known as the sexually transmitted infections or the sexual health clinic. STIs, like I mentioned, including HIV, which a lot of people think they're 2 separate things, but HIV is a sexually transmitted infection. So we like to include that in here. So STIs, including HIV, are infections. And there are different types of STIs, bacteria, viruses, or parasites. For example, some of the most common STIs, like gonorrhea, chlamydia, and syphilis, those are bacteria. And it's a very important distinction to know because bacterial infections can be cured with medications, with antibiotics. And then there are viruses like herpes, HPV, and hepatitis A, B, and C, which cannot be cured except for hepatitis C, but these are manageable. So these can be transmitted during sexual contact, which is usually through oral, anal, or vaginal sexual contact. And some STIs may show no symptoms. So regular testing is essential. So HIV, it's been in the mainstream for the last 50 years. HIV stands for human immunodeficiency virus. And the part that's the human part, it refers to the virus infects human beings. The immunodeficiency is a weakened or compromised immune system. So it's what helps you fight off when you're not feeling well. Your immune system, it kicks in. So HIV targets initiates that, and it weakens or compromises your immune system. And the virus itself is the agent that infects the host cells and reproduces itself. We're going to see an image of how this happens. But here are some of the latest numbers that we have comparing 2022 to 2023. And this is specifically for New York City. So as you can see, gonorrhea, chlamydia, late syphilis or unknown duration, congenital syphilis, and HIV have all been on the rise. And some of the numbers that you may have seen from 2020, 2021, and 2022 and 2023 are a little different because of the pandemic in 2020. Services were not available, or people were not able to get to the services, or they just delayed testing. So we didn't get accurate numbers for 2020 and I would say into 2021. So 2022, as you can see the column, the second column in 2022, the numbers make it seem like they're going down into 2023 for some of these, like primary, secondary syphilis and early latent syphilis. But we also have other reports where we focus, for example, Black and Latina women, cisgender women in New York City have had a spike in syphilis cases. In general, most, if not all, have gone up since 2020. And that's concerning because that means more people are going undiagnosed. And it's great for people to understand how an STI works. For example, syphilis may have a chancre, which is like a little pimple, an inverted pimple, where the syphilis bacteria enter the body, but it doesn't hurt and it doesn't bleed. It just looks like you may have nicked yourself. So you may be unaware that it's syphilis, or you may think it's something else. Maybe you were shaving down there and you're like, oh, well, that must have been from that. And then the chancre goes away on its own within 2 weeks or a little bit more or less. So people may go having syphilis for long periods of time. And syphilis is one of those quiet STIs where it will give you a symptom or two. If you see it, if you spot it, you may know what it is. But if you don't know what it is, then the syphilis will continue replicating in your system. And that's why we have it broken down here into separate parts. It says primary, secondary syphilis, early latent syphilis, and late latent syphilis. And that's really within the first 6 months, 6 to 12 months, and then 12 months and more. Because syphilis can stay in your body for decades and cause damage. One of the more concerning numbers is congenital syphilis, which is the second to last row. Congenital syphilis is when a pregnant person has syphilis and passes this to the fetus. And this can cause stillbirth. It can cause neurological problems for the fetus when they're born. And as we can see, the numbers have gone up between 2022 to 2023. And that's 67% from 2022 to 2023. So that's very concerning because these are preventable STIs. These are preventable transmissions. HIV cases have also gone up, and that's also concerning because New York City has the ND epidemic for HIV, and the numbers have gone up. As we were talking about HIV going up, 240 of the people newly diagnosed with HIV were age 50 or more in New York City, including 76 of the people who were concurrently diagnosed with AIDS. And what AIDS is when a person has HIV and they may not be getting treatment or their medications may not be working for them, you can develop a secondary part of HIV, which turns into what we know as AIDS. And this means that your immune system has been compromised and you're more prone to secondary infections or diseases. I always like to use the example of the dander from pigeons in New York City. And most of us don't have any problems. But if your immune system is compromised, this can cause lung issues for you. It's people who are diagnosed with HIV, concurrently diagnosed with AIDS, means that they have had HIV long enough in their system that it has weakened their immune system and they also now have AIDS, which is reversible if they get on the right medication treatment and continue seeing their doctors. So out of this 176 people newly diagnosed with AIDS, they were also age 50 or more years of age. And there are estimated almost 50,000 people with HIV age 50 or more living with HIV. 1,260 deaths among people with HIV were age 50 or more. So we want to bring attention to this. These are the numbers for the latest reports in 2023. And this is how it affects folks that are 50 years or older. And we go back to those quiz questions. Should we use condoms? Will it prevent this? Do I need to worry about that? It's important to understand prevention and the numbers and why it's important. And I also mentioned Black and Latinas with higher rates of congenital syphilis and syphilis itself. Here we see that Black and Latino people consistently experience the highest numbers of new HIV diagnoses, which combined makes up 83% of new diagnoses in this age group in 2023. So that means that folks that are 50 years or older that were diagnosed with HIV and or AIDS, 83% of them were either Black or Latino. So that's to bring light to the systemic barriers or the difficulties that some folks have in getting the services that they need and the access that they need. And here we have some representation from a partner organization called SAGE. They provide services also. So we have their image here. So some common misconceptions about sexual health in older adults. Sexual health care and education are only for people of reproductive age. A lot of people think that STIs or sexual health itself is about getting somebody pregnant or getting pregnant. And it's not just about that. It's about pleasure. It's about being with somebody. One of the other misconceptions that older adults do not desire intimacy or sexual relationships because they're older. But as we have seen in the numbers of new diagnoses, people 50 years or higher are prevalent to certain STIs. Another misconception is sexual health is not a priority to older adults in healthcare settings. And that is a misconception in the sense that we offer services, not just the Department of Health, but in general, health services are there. If you do see a doctor and they're not interested in what you have to say, then change doctors. There are plenty of doctors out there that have the right knowledge and education and information to help. Another misconception, sexual health education has often emphasized pregnancy prevention over STI prevention. Sexual health is everything. It includes your physical, mental, psychological health. All of that should be put primarily to help you in what you need. There are a couple of things that you need to remember when you're ready to visit the doctor. Make sure to bring a list of your medications, including your prescriptions, over-the-counter herbal supplements. For example, when my mother has to go see a doctor, I always take pictures of all the medications because the doctors will ask, what are you taking? So it's always best to be prepared. Make sure to bring your insurance card. Also take a picture of it. I say take a picture of everything so that you always have it with you on your phone. But also bring it with you. Bring some paper and pen or a smartphone so you can take notes or record, or bring somebody, a family member or a caregiver, so that you can have that discussion with your doctor. Also make sure to pre-write all your questions on your current health concerns. So if something happens to you today, you're not going to see the doctor for another 3 weeks. Make sure to jot it down. The doctors can use this information to put it all together. And during your visits, make sure to tell the doctor all your symptoms, concerns, fears, and discomforts, because they'll be able to better understand what's going on. Let's use syphilis as an example. Syphilis, like I mentioned, can create a chancre that will disappear within a couple of weeks. So maybe you don't think that's important, but that's important to tell the doctor. I saw something like an inverted pimple or something in my nether regions, but it went away. So that can tell the doctor, oh, maybe it's syphilis. They can do blood tests for that or rapid tests for that so they can check. Also important to mention any worries about cost, coverage, and filling with health insurance and Medicaid, Medicare. This has been a top priority when I go with my mom, who's almost 80, and my auntie, who's 84, and they go to the doctor, and one of their biggest concerns is that they're going to be charged. And you do get bills from labs and from certain doctors, but Medicaid, Medicare is supposed to cover most of this, if not everything. So make sure to voice it to your doctor, because the doctors and the nurses and the staff that work at the facility that you visit, they know how to work this. So if they're aware of what's going on, maybe they can help you. Like if you received a bill for $160 for something that you were told was going to be paid, make sure to bring it up to their attention. Ask questions when you don't understand something. It's very easy to lose yourself in a discussion, especially if you're thinking about what's going on personally with your health, and then the doctor's trying to explain something to you. So make sure to ask questions and just be honest and be like, I did not get that. I'm sorry. Can you tell me that again? Same thing goes with instructions. Write the instructions down. Or if there's a brochure, take it with you, or record it, or ask the doctor to write it down in words that you understand. And also ask and repeat. That's something that we like to do at the Department of Health. We call it active listening. When we're listening to somebody, let's make sure to repeat what they said so we understand exactly what they said. We're going to very quickly look at anatomy and aging. People that have penises, testosterone declines and changes sexual function. Here we have an image of external and internal for the penis. We see the penis, the testicles, the urethra, and what these changes in testosterone mean is that shorter orgasms and less forceful ejaculations and less semen ejaculated. So this may lead to different behaviors. More stimulation will be needed to achieve and maintain erections and orgasms. So that's something to keep in mind for people that have this as they get older. For people that have vaginas and uterus, there may be a higher chance for HIV and STI transmission after menopause, because as you're aging, people that have a uterus may have increased risk of tearing and abrasion during sex due to hormonal changes, natural thinning of the vaginal walls, and decreasing lubrication. And friction can create microscopic tears. So here we have an image on the right of the external anatomy, and on the left, we have an image of the internal anatomy. So you can get a better understanding. It's not just about what's on the outside, what's going on inside. So inside, including the rectum, which we don't have a full picture of it here, but the walls may thin. These kind of anatomical sections are made to absorb liquids. So you have to keep that in mind as you're getting older as well. Lubrication is important. And it is, regardless of what age you are. So some of the predictors of getting an STI, as we mentioned, there are several of them: not using condom or condomless sex, having other STIs or sores. And that's because having other STIs or sores can cause micro tears, or it can have open abrasions. So it makes it easier for bacteria and viruses and parasites to be transmitted. The type and frequency of sex that you're having, and very importantly, alcohol and drug use, because that can lower your senses. So you may be more willing to do things, or you may not be aware. And also your sexual network. One of the things that is important to understand in sexual networks, especially for folks that live in housing environments, they see the same people, the same workers. And for example, when I've gone to do these kind of presentations, adult centers where they live and work in the same location, a lot of them get nervous and start laughing because they know what's going on inside. They know that the workers and the people that live there, they may be having relations. So it's very important to understand that, because if you're all having sex with the same people and one of them gets an STI, then most likely other people in your network is going to get it as well. So very important to know that difference. How HIV is transmitted is most often people get HIV through condomless anal or vaginal sex, or sharing needles, syringes, or other drug injection equipment, and less often through birth or nursing from a person living with HIV, needle sticks or blood transfusions and products. And we'll talk about more as to why that is less often, because there are preventive measures and emergency measures. But of course, the only way to know for sure is to get tested. And here's the image of how HIV functions. So let's start from here. This is the HIV virus entering your system. And as it enters your system, HIV looks for the white blood cells, or CD4 cells, or helper cells as they're called. And these are the cells that your immune system sends out. So when you're not feeling well, your immune system throws out all these CD4 cells, also known as white blood cells. And that is what HIV targets. And HIV, once it enters your system, it looks for these CD4 cells and attaches itself to the cell. And as it attaches itself to the cell, it turns its RNA into DNA. So it puts it inside the white blood cell, as you can see here in this image, so that it combines. So this makes the CD4 cell, or the white blood cell, become integrated with the DNA of the HIV cell, as you see in this section here. The white blood cell starts creating HIV DNA, which in itself creates more of the HIV virus, as you can see here. And then that gets sent back out into your system. And it's not just 1 to 1, it's like 1 to millions. So one HIV virus or cell enters your system and it attaches itself to the white blood cell. That white blood cell will create hundreds, thousands, or millions of HIV cells, and then the white blood cell itself will die off. And that's how your immune system gets lower and you become more prone to other infections. So the HIV matures and invades other cells, as we just saw this process, and it just keeps going and going. But there is preventive measures for this, and not just the preventive measures like condoms. We have PrEP, which is pre-exposure prophylaxis. And let me start this off with PrEP. It's highly underutilized by cisgender women. I want to put that out there because they are not using it because they don't think it's available for them. A lot of people don't even know what it is. So let me go over what it is. And our sexual health clinics can connect you with folks that can offer you PrEP. You may have already heard about this, but it's a safe and effective measure to help prevent HIV from replicating in your system. So if you are exposed to HIV, the PrEP medication, if taken correctly, will lower the chances by up to 98% of the HIV virus replicating itself in your system, and then it will just die off. This prevents the HIV virus from replicating in your system. PrEP does not prevent other STIs, so very important to know that. If you're on PrEP, do not stop using condoms. Do not think that you're being protected for other things. This is specifically only for HIV. So PrEP is available as a daily pill or an injection you get every 2 months. The daily pill, of course, you take every day, and it takes anywhere between 7 to 21 days, depending on the body part that you're using to prevent HIV. And the injection is every 2 months. It will not interfere with hormone therapy if you're taking some kind of hormone therapy or other medications. PrEP on demand is available, and what that is, you can take the medication, take 2 pills on the day you may have been exposed to HIV, or maybe you're planning on having sex with somebody that may have HIV, or maybe you don't know, so you want preventive measures. So you take 2 pills that day, 1 pill the next day, and 1 pill the day after that, which is 4 pills in total. Of course, ideally, you would be taking this pill every day before that, so that you have 100% of the medication in your system, and you have a much higher rate of prevention. And you can always check for more information at our website at nyc.gov/health. There's also emergency post-exposure prophylaxis, which is emergency PEP. HIV is less often transmitted through needle pricks, through pregnancy, and that is because there's this medication that you take for 28 days, and it reduces the chance of HIV by at least 80%. And most most cases, it has been very successful. So if you know 100% sure you were exposed to HIV either sexually or through a needle prick or by sharing needles, then you can take this medication. It's best to take it as soon as possible or up to 72 hours of exposure. And there is a PrEP hotline that you can call 7 days a week, 24 hours a day, and they will try to connect you to somebody that will prescribe you the medication or a prescription or the medication itself and put it in your hands within hours. There's also undetectable equals untransmittable. So people who have HIV and on treatment, they can reduce the amount of the virus in the body to levels so low that the virus is undetectable, which means that if you do have HIV and you are taking treatment properly and seeing your doctor and they test you, it'll show the levels to be so low that it is impossible for you to transmit HIV to another person through sexual contact. What that means is that people who maintain a non-detectable viral load, if it's 200 copies or less, then that means you are undetectable, which you need to remain for at least 6 months in order to be considered undetectable. And this has been proven to help people not transmit HIV if they have HIV. This is called U equals U, or undetectable equals untransmittable. More information online as well. There is a new preventive measure or intervention, which is called doxypep. And this is the use of doxycycline taken within 72 hours after having condom sex, similar to post-exposure prophylaxis, the emergency PEP that we discussed, and it lowers the chance of getting syphilis, chlamydia, and gonorrhea. So this medication, doxycycline, is what we normally use to treat syphilis, chlamydia, and gonorrhea and other STIs. And if taken correctly, then it will reduce the chance of you getting syphilis, chlamydia, and gonorrhea if exposed to or if having sexual contact without condoms. It's recommended for men who have sex with men and transgender women with an STI that have had an STI in the past year. But you should talk to your doctor, and if you're sexually active, they'll make the decision if doxypep is something that you should take. We do have a disclaimer here that it's not recommended for cisgender women due to lack of sufficient trial data, and that's because the people that were on the trial of testing the medication out, the majority of them were MSMs or men who have sex with men and transgender women. So there's also condoms. We have all these different types of condoms that you can get for free at the sexual health clinics. We have internal and external condoms. Internal condoms are something you can put in the vagina or in the rectum. External condoms are something you put on the penis. There are dental dams, which are on the bottom right here. It's the last picture. This is a dental dam here. And that is a piece of latex that you stretch out over the vagina or the rectum. That way there is no transmission or connection. They also come in flavors, so you can get like strawberry, mint, etc. Always very important to use the right type of lubrication as well, not just a condom. Even though the condom has some lubrication, more lubrication is always better. There are different types. There are silicone-based, there are water-based, so make sure to test these out. We also have EPT, which is expedited partner therapy. And what EPT is, it allows your health provider to give you a prescription or the medication itself to your sexual health partners. What this means is that if you were diagnosed with chlamydia or syphilis, then if you have a partner or partners, and then if you think your partner or partners gave you this, you can get the medication for them. And it makes it easier to treat infections before it continues or getting reinfected. And this is used for chlamydia, gonorrhea. And of course, more safer sex practices are about talking about sexual consent. Consent is very important. Planned Parenthood has this fun image of consent, which is fries. Using latex barriers, of course, such as dental dams, gloves, and finger cuts to prevent transmission of STIs, other bacteria and fungi. Using condoms on penetrative sex toys and penises as often as possible during general anal sex. Using lubrication when having general anal sex to prevent discomfort and injury, like silicone and water-based loops are safer to use with latex condoms. And we also suggest not to douche vaginally or clean the inside of your vagina with water or other fluids. We like to say that the vagina is like a self-cleaning oven. It'll clean itself. I know a lot of people like to do it themselves. Some of it maybe culturally, but we suggest not to do that, especially if you're going to have sexual intercourse. And as we mentioned, there's the New York City sexual health clinics. Right now, we have 6 of them that are open up offering services. In total, we have 8, but the other 2 clinics are offering different types of services. And we have the location here. In these clinics that we have, these are some of the services that are included. But more important, here is the hotline to the sexual health clinics, because we always tell people, call in first. Make sure that the service that you're looking for is being offered at the location that you want to go to. Because some of these services, for example, like PEP, PrEP, initiation, and counseling, are by appointment only. The location that you want to go to is offering this. They may not be able to promise you an appointment that same day, but they will be able to connect you. Dental dams are very difficult to get our hands on, expensive. Yep. However, if you get your hands on flavored condoms, it's the same thing. You can just cut them up and use them up because they stretch out and they're flavored. So of course, the flavor type will go to you. and the non-flavor site will go to the body part, to the vagina, rectum, etc.
And then the dental dam thing is like you cut off both ends, cut it down the middle, and it's just a piece of latex. So it's pretty much the same thing. And it is impossible to find dental dams these days. Like you cannot. I remember there was a time when it used to be like they were just part of the condom landscape, but they're just not anymore. So we get a little DIY about that.
And don't forget the lube.
Don't forget the lube. We have tons of lube too.